Hey there, wanted to make a short video about an article that I read just the other day. Actually, it just came out today, and it's an article that talks about nasal irrigation possibly being more important than hand washing when we're dealing with infectious diseases. Of course, right now we're thinking about the COVID-19, but any type of infectious disease like the common cold or influenza. And we know how important that hand washing is to prevent the spread of infectious diseases, but there's been some studies done and some anecdotal studies as well out of the Far East about flushing your sinuses, and that may be even a better way to inhibit that progression of the viral illnesses like COVID-19. So there was an article on MSN, site called MSN Best Life, and it was Dr. Amy Baxter, who is a pediatric physician in Atlanta, Florida, or Atlanta, Georgia, and she said that nasal irrigation is a rarely discussed strategy, and she thinks that it can help reduce the progression of illnesses in those who have tested positive for COVID-19 infection. In April 2nd, 2020, there was a British medical journal paper that a response was sent in about the lack of personal protection equipment on COVID-19 front lines. And there was a professor, Robert Matthews, who brought up the importance and potential usefulness of oropharyngeal washing to protect healthcare workers from infection. They said that nasal, and this is a direct quote, nasal irrigation or nasal wash has long been considered an effective way to remove viruses or bacteria from sinus cavities. Baxter has multiple reasons for believing that this approach can be effective in preventing the spread of coronavirus from worsening in a sick patient. So researchers have found that the viral load of this SARS-CoV-2, which is really the name of this virus, that it tends to be the heaviest in the sinuses and the nasal cavities. And if you've been tested for it, you know how they stick that Q-tip way up into your nasal cavity to swab that. Well, regularly rinsing your sinuses makes a little bit of sense, since it would help clear that pathogen out and prevent it from gaining a strong foothold and migrating down into your lungs from the oropharynx area. So they did find that that age and gender discrepancies are observed in COVID-19, that they also support nasal irrigation. We know that children are at virtually no risk. I'm not saying they're no risk, it's virtually no risk. But death rates among the elderly are at their highest. We know that more men than women also die from the infection. And what we also understand is that children don't really fully develop sinuses until they're in their teens. Males have larger cavities than women, and the cavities are largest in those over 70 years old. So it would make sense that those people would could store more of the virus up into this area, into the sinus area. And so washing that area out periodically could help reduce that viral load. So the research has previously demonstrated that irrigation of the nasal area reduces the symptoms and duration of other viral illnesses, such as the seasonal flu and the common cold. And in fact, one study, they showed nasal irrigation and gargling with a hypertonic saline, salt water, were found to reduce the duration of the common cold by almost 2 days and reduce transmission within the household by up to 35% by reducing that viral shedding, as long as the nasal irrigation and gargling was done within 48 hours of symptoms onset. So it hasn't really been studied as a preventative method for COVID-19 yet, but there's reason to suspect that nasal irrigation might be helpful. Now, this Dr. Baxter in Atlanta also said that COVID-19 death rates in Southeast Asia, like Thailand, Vietnam, Laos, they've been surprisingly low. And we do know that nasal irrigation is a very common practice in those areas. So about 80% of those people do nasal irrigation And you can look up on Dr. Mercola's website, and he tells you how to irrigate your sinuses and how exactly what to mix together. Now, gargling, they also say, can help reduce the risk of these infectious diseases, these infectious viruses migrating into your lungs. A March 29th, 2020 New York Times article said, or Dr. Neil Nato said, there's no firm proof that gargling can prevent COVID-19, but there are virtually no downsides to the advice, just because it hasn't been studied. And we also note that East Asian countries such as Japan see gargling as a very common sense hygiene practice. They do it all the time. So what do you use for that? You have to use an over-the-counter oral gargle solution. It is what's called a povidone iodine solution. Now it's betadine. Now you don't want the betadine that you use to disinfect your skin. You want the stuff that specifically says that it's a gargling agent. So it's specifically for sore throat gargle, not products intended for cuts and wound care. So that's real important. So don't go gargling betadine that you find that cleans wounds and that type of thing. Another prevention strategy, and this is something that I've done, is I nebulize hydrogen peroxide. Now you got to use 1% or less hydrogen peroxide. It effectively inactivated a range of human coronaviruses, including those responsible for SARS and MERS, within 1 minute of exposure. So you get exposed, you do the hydrogen peroxide nebulizing, and that effectively inactivates the virus with hydrogen peroxide. In fact, your cells sometimes make hydrogen peroxide to do the very same thing, so you're just helping your body to do it a little bit more effectively. So you're helping your body do those things. You see, coronaviruses are held together by a lipid, a fat envelope, and hydrogen peroxide dissolves that fat membrane, and it causes the virus to basically fall apart. So some of your immune cells, like I said, actually produce hydrogen peroxide, and they destroy pathogens by killing the infected cell, which essentially shuts down viral reproduction. So hydrogen peroxide therapy, in essence, is only aiding your immune cells to perform their natural function more effectively. So many studies have looked at the use of hydrogen peroxide against different pathogens. One of the most recent review of 22 studies that was published in March 2020 in the Journal of Hospital Infection, they found that a 0.5% hydrogen peroxide effectively inactivated a range of human coronaviruses, like I said just a couple of seconds ago. So you have to be very careful about these things. So you want to go to different websites, look up nebulizing hydrogen peroxide. Dr. Mercola's got great articles on it, and there's several others that do as well. But these are just a few of the things that you can do to help mitigate either your exposure to COVID or many other coronaviruses. Okay, so we're not just talking about COVID-19. We know that it works against these other coronaviruses. There's no reason to believe that it can't help with this coronavirus, this novel coronavirus. So that's your little health minute for today. So don't only wash your hands, but make sure that you gargle, and if you and you do your nasal, what they call lavage, you do the nasal drainage or the nasal washing, and then also that hydrogen peroxide nebulizer also works. But again, very, very important. Make sure you look that up, because you don't want to have too much hydrogen peroxide. That can damage your lungs, okay? So have a great day. We appreciate it, and we'll talk to you later.